Here's a brief history lesson on asthma, diabetes, and epilepsy. Ludwig van Beethoven, asthma. Charles Dickens, epilepsy. Thomas Alva Edison, diabetes. Harriet Tubman, epilepsy. John F. Kennedy, asthma. Leonardo da Vinci, epilepsy. Vincent van Gogh, epilepsy. We can learn valuable lessons from heroes of the past that teach us how to deal with heroes of the future. After all, you never know who tomorrow's brightest stars will be. Look at what you accomplish at your school each day. Each of you have challenges and responsibilities to help students learn, eat well, get them to and from school safely, create a clean environment, and practice teamwork. These responsibilities become a little more challenging when a student has a health condition. By watching this program, you will learn about 3 common medical conditions: asthma, diabetes, and epilepsy. You'll learn how to help students deal with these health conditions day to day and in an emergency. By understanding more about asthma, diabetes, and epilepsy, you'll be able to help these students feel like they aren't so different from everyone else. Anyone who works at a school is likely to encounter students with asthma, diabetes, or epilepsy. Several laws in the United States, including the Americans with Disabilities Act, protect the rights of students with health conditions. These laws work together to spell out the students' medical needs and describe how the school will meet these needs. Be sure you know school policy and your responsibilities. Asthma is a lung condition caused by an increased reaction of the airways to various stimuli. In the United States, asthma affects almost 9 million children under the age of 18. Of them, nearly 4 million have at least one asthma episode each year. An asthma episode is a series of events that narrows the breathing tubes. During an episode, a student may cough, gasp for air, or breathe with a wheezing or whistling noise. The student may have no energy for play or may complain of tightness or pain in his or her chest. Situations that trigger an episode are different for each person. Some common triggers include pollen, mold, or animal dander, perfume or other strong odors, vigorous exercise, cold, humidity, or sudden temperature changes, or cigarette smoke. Students diagnosed with asthma usually take medications to help control the swelling in their bronchial tubes. At the first sign of an episode, they also breathe medicine from an inhaler to open their airways. You can help students with asthma by making sure they have ready access to their prescribed medications and inhalers, which should be kept in a designated place according to school policy. If a student has an asthma episode, it's important to avoid drawing extra attention to the student. Stay calm and reassure the student. Don't leave him or her unattended to get prescribed medications or an inhaler. The inhaler should relieve breathing almost instantly. If the student continues to have difficulty breathing, remember that it's always better to overreact than underreact in an emergency situation. At all times, try to stay calm. Alert the school nurse if available and your local emergency medical response system, or 911, if the following occurs. The student can't talk. The inhaler does not provide relief. Or the student's lips or fingernails look gray or blue. In any emergency situation, always be sure you follow your school's policy on medical response. Diabetes is a condition where the body makes ineffective, little or no insulin to maintain the proper amount of glucose or blood sugar which cells need to function properly. Students with diabetes must check their sugar levels regularly. They maintain the appropriate level by drinking and eating proper fluids and foods, and by taking medications, usually insulin. Students with diabetes face 2 problems that every member of the school staff must learn to recognize: high or low blood sugar levels. Some symptoms are very similar for high and low blood sugar, and only a blood sugar test can provide an accurate diagnosis. Low blood sugar, or hypoglycemia, occurs when the blood sugar level is low. This can result from too much insulin, too little food, or too much exercise. A student whose blood sugar level is below normal may experience physical and behavioral changes. This student may feel lethargic, shake, sweat, or have a change in personality. If a student has low blood sugar, they must consume a simple sugar like glucose tablets, fruit juice, or sugar-sweetened soda pop. If the student cannot swallow or is not conscious enough to consume a simple sugar, call EMS or 911 immediately. If symptoms are left untreated, eventually the student will lapse into a diabetic coma. A student with diabetes must be permitted to eat or drink whenever he or she has low blood sugar levels. Don't leave a low student unattended or send him or her to the nurse's office alone. Students with diabetes also can develop high blood sugar or hyperglycemia. This happens when there is too little insulin in the system or when the child eats too much food that is converted to sugar. When blood sugar levels get too high, students with diabetes may experience dry mouth, vomit, be thirsty, have breath that smells fruity, or have abdominal pain. Check your school policy to learn how to intervene when a student doesn't recognize an impending diabetic emergency. A student whose blood sugar is high needs additional insulin and liquids without sugar. Diet soda and water are the best choices. Similar to hypoglycemia, if hyperglycemia is left untreated, the student will lapse into a diabetic coma. Diabetic students who have high blood sugar levels must have free access to water and the bathroom. They also must be able to check blood sugar levels and inject insulin when needed. Be sure you are familiar with your student's daily routine and work out a plan that will be helpful to you and the student. Follow your school's policy on blood sugar checks and insulin injections. Avoid focusing undue attention on the student. Do not allow the student to leave the classroom for the clinic or office without an escort, be it another faculty member or a student.
It is. It's called
Epilepsy can occur at any age. It may be caused by an injury, but often the cause is unknown. Students with known epilepsy usually take various medications to control or prevent seizures. Epilepsy does not affect intelligence or creativity, judgment, or mental health. It's simply the result of mixed electrical signals in the brain. Recognizing the signs of a seizure is very important. Some seizures leave a student unconscious on the ground. Others are far more subtle. When most people think of a seizure, they envision a general seizure, called a complete seizure. In this type of seizure, the person abruptly loses consciousness, falls and stiffens, and soon begins to jerk. After a period of time, the person relaxes and regains consciousness, but may be sleepy or seem confused. Other types of seizures, called partial seizures, may be more difficult to recognize. Here are some symptoms to watch for: fluttering eyelids and loss of awareness for a short period of time, continuing an activity but with no apparent awareness of what's going on, falling to the ground because of sudden loss of muscle tone, brief muscle jerks or tick-like motions of one group of muscles, twitching, seeing, smelling, or hearing things that aren't there. Unless you recognize these symptoms as a possible seizure, it may go unnoticed or be written off as bad behavior or goofing off. If you observe a student having a seizure, it's important that you take the correct actions and follow school policy. First of all, stay calm. How you act sets the tone for how others behave. Ask students not to crowd around. Tell them that it's a seizure and it will be over shortly. Approach the student gently so you don't frighten him or her. Your main task is to protect the student from hitting hard or sharp objects. Put something soft under the head if possible. Do not move the student unless they are in danger. Do not put anything in the mouth. Allow the seizure to take its course, but check to see how long it lasts. In most cases, the seizure will end quickly. Follow your school policy on handling medical situations. Don't leave the student alone until he or she is fully recovered. In some cases, students may lose bladder or bowel control during a seizure. Try to protect the student from embarrassment as much as possible. Call 911 or alert the appropriate emergency response system for seizure cases if the seizure lasts more than 5 minutes, the student is pregnant, the seizure follows a head injury, or the student has no previous history of seizures. There may be times when a student is undiagnosed. If you observe unusual behavior that could be a seizure, pay close attention to what is happening. Usually, the person is not aware of what he or she is doing. Note movements, consciousness, and how long the situation lasts. Report the incident to the proper personnel. There are many steps you can take to support students with asthma, diabetes, and epilepsy. Remember that the student is not the condition. Never say, the asthmatic kid or the epileptic or diabetic kid. Don't draw unnecessary attention to the student. Know what to do and what the student should avoid. Then quietly help the student take control of his or her condition. For example, if you know a student needs to snack at certain times, you can work out a plan just between the two of you. Learn what could trigger a medical problem and take steps to avoid these situations. For a student with asthma, you can remove items with strong odors or keep classroom pets in another area. If bright or flashing lights trigger epileptic seizures, you can use shades or remove any lights that flicker. Under certain conditions, you may be able to take steps to educate other students about the condition, but never embarrass the student involved. Be sure students know that these conditions are not contagious. There are many books and educational programs that can help students understand what's going on and how they can be supportive. Make sure other students know whom to notify when a fellow student needs assistance. Be sure students know that everyone needs help sometimes. In the last few minutes, we've looked at 3 common medical conditions: asthma, diabetes, and epilepsy. You've learned how you can help students deal with these conditions day to day and in an emergency. You've also learned that you can help students feel in control of their condition by planning ahead and being prepared. Your actions help define how students with medical conditions see themselves. When you treat the student's condition as a normal part of life, you encourage them and their fellow students to act this way too. In turn, students can stop focusing on their medical condition and put their energy toward living their daily lives and creating bright futures. Because you never know who will be tomorrow's shining stars.